My name is Tessa Schultz, and my new drug presentation was on Fabior. Fabior is a drug that was FDA approved earlier this year for treating acne vulgaris in individuals 12 years and older. It is the first and only topical retinoid. It belongs to the acetylenic class of retinoids, and retinoid is a derivative of vitamin A, which helps with the health of the skin. Mechanism of action. The exact mechanism of Fabior at this time is unknown, but they do know that it undergoes deesterification to form the active chemical terazotenic acid. So it is a prodrug. It becomes active after it undergoes deesterification. Fabior, once it is transformed into its active form, binds to 3 different retinoic acid binding sites, alpha, beta, and gamma. And they believe that Fabior helps by preventing overproliferation of skin cells, and they believe it also has an anti-inflammatory effect on the skin. Pharmacokinetics. This topical medication comes in a foam form. You apply a small thin layer of foam to the affected areas. It transforms into that terazotenic acid, as I mentioned earlier, and then it undergoes metabolization. The drug is highly protein bound, and it is eliminated through the urine and feces. Pharmacodynamics, the exact effect on the body at this time is unknown, but they do know that it belongs to the retinoid class, which I mentioned earlier is a derivative of vitamin A, and it helps with cell proliferation and differentiation. When I was doing some research, I found that Accutane is also part of the retinoid class, and Accutane is another powerful medication that treats acne. And it said that Accutane activates the retinoic acid receptor sites as well, and it inhibits ornithine decarboxylase, which decreases polyamine synthesis and keratinization. I didn't know the exact pharmacodynamics of Fabior, but since I saw the Accutane, I saw it was the same class, I thought I'd explain just what Accutane does. Drug interactions. There have been no specific studies done to determine if there are any drug-to-drug or food-to-drug interactions with Fabior, but they do advise patients to stay away from the use of agents that have a tendency to dry out skin, since Fabior can also have effects of drying out skin. They did say to stay away from oxidizing agents such as benzoyl peroxide because it is known to decrease the potential therapeutic effects of Fabior. It said that if a patient wants to apply the benzoyl peroxide and Fabior, to just do it at 2 different times so they don't interact. Part of our teaching as nurses is to realize and teach patients that even over-the-counter medications can have benzoyl peroxide, and we may not even know it. These pictures, the Neutrogena Deep Clean, Proactive, and the Oxy, they all are agents that contain benzoyl peroxide. So we really need to tell patients to look at other acne medications that they may be using to see if it has that benzoyl peroxide. There have been no drug-to-drug interactions with oral contraceptives, although they have not done any tests on the progestin oral contraceptive. Some adverse effects that showed up during clinical studies were irritation, dryness, erythema, exfoliation, pain, and photosensitivity. The studies said that these side effects peaked at about 2 weeks and slowly declined over the remaining time of the study. Some nursing implications that we need to keep in mind is to educate patients on the application process, teach them that they're going to be applying a thin layer of the Fabior foam to their affected areas. They need to wash their hands after applying. It is flammable, so they need to keep it away from smoke, heat, or fire. They need to keep it out of reach of children for safety measures. And then since some patients have had photosensitivity while on Fabior, we need to teach them to either use sunscreen or a hat to prevent them from overexposure to the sun. We need to also teach them it is a pregnancy category X. So if women are on Fabior, they need to be on some type of form of contraceptive. And to advise women that are pregnant or breastfeeding to not take Fabior. Fabior can actually go through the breast milk and cause harm to the infant. Evaluating the effectiveness of Fabior, of course, would just be looking to see if their skin is clearing up, if they have a decreased number of lesions, and if their skin is getting healthier and clearer. And that is the end of my presentation. Thank you.